Today, our topic is to take history from a patient presenting with diabetes mellitus. So, we'll start about with asking about the duration of diabetes. Is it will help us whether the patient is having any chronic complication or not. So, duration is important. Then we will ask how the diabetes was diagnosed. Was it a accidental finding, or was patient having any symptoms like increased thirst, increased urination, polyphagia, weight loss, or weight gain? So, what was the reason for that it was diagnosed, or whether the diabetes was running in the family and routine screening was done and it was diagnosed? Then we'll ask about the control of diabetes and what medication patient is using, particularly if the patient is using insulin. We will ask about what type of insulin, compliance with the medication, and we will ask about recent A1C, ask about fasting and postprandial value if the patient knows it, and then we will ask about acute complications like DK. We'll ask if the patient RBS has raised too much and the patient develop increased breathing rate and confusion. So these will help us identify DK and HHS, which is hyperglycemic hyperosmolar. We'll ask about if the patient sugar has dropped down too low, any hypoglycemic event in the past. Then we will ask about hypoglycemic symptoms if the patient is having any, like any sweating, palpitation, dizziness. We will ask about those. Then we will ask about the chronic complication of diabetes, which are divided into macrovascular and microvascular. Macrovascular include coronary artery disease, cerebrovascular disease, peripheral artery disease. Microvascular include retinal disease, um, renal disease, and neuropathies, especially in the lower limbs, in the stock and gloves and stocking the distribution. Autonomic neuropathy, asking whether the patient has any loss of libido affecting marital status. We'll ask about any foot disease, and we will ask about situation of diabetes is there always with hypertension. So we'll ask about hypertension and hyperlipidemia. In the past history, we'll ask about other endocrine disorders like Cushing syndrome, acromegaly, and pheochromocytoma, which can cause diabetes. We'll ask about pancreatic diseases and previous gestational diabetes. In the family history, we'll ask about diabetes running in the family. That is very important. Then we'll ask about the drugs, particularly glucocorticoid, oral contraceptive, thiazide diuretic, atypical antipsychotic medication, tacrolimus, which is immunosuppressant used in the renal transplant patient, and HIV drugs, protease inhibitor, because these all can cause diabetes. Thank you so much.